presenter is Dr. Rajiv Ishwari, who is the president of SAHIA, the South African Health Informatics Association. Please give him a round of applause as he comes up.
My name is Dr. Rajiv Rao Ishwari. Today I'll be discussing one of the most critical challenges and opportunities in global health, scaling telehealth across rural Africa. I must admit that I tried my bit in South Africa, but I didn't succeed that much, but I've taken up something which I believe is still like a fairy tale, but like I said, I haven't given up on trying. This isn't just a technological discussion. It's an imperative rooted in infrastructure, policy, and innovation. I represent SAHIA. SAHIA is the South African Health Informatics Association. It's an advocacy organization, and I'm the chair of the Pan-African Telehealth Network under HELINA. HELINA, like I said, is the umbrella body for all the informatics associations in Africa. And we are working collaboratively with partners like Africa CDC and International Medical Exchange to make digital health equity a reality. Across Africa, over half of our people live in rural areas. In some regions, a single doctor serves 50,000 people. Many patients travel over 100 kilometers. I'm exaggerating a little bit, but around that. Sometimes on foot or unsafe roads just to see a clinician. The 100 kilometers diagnosis, a journey no patient should have to make. The result, delayed preventable deaths, deepening inequity. This slide reflects the three delay models: delay in deciding, delay in reaching care, delay in receiving adequate care. The reality creates a profound divide. On one hand, we have urban, well-connected healthcare systems with specialists, diagnostics, and private insurance. On the other, rural communities face a severe shortage of staff, long-distance travels, and lack of basic digital and power infrastructure. Bridging this gap is not just about technology, it's about achieving digital health equity. It requires a fundamental commitment to cross-border collaboration and inclusive innovation that leaves no one behind. This is where our organizations come in. The South African Health Informatics Association and Health Informatics Association of Africa are at the forefront of driving digital health transformation. We are not just building platforms, we are building capacity. We are trying. Our collaboration focuses on promoting innovation, harmonizing policy across borders, and most importantly, ensuring equitable access to health information systems for all Africans on the continent. So why now is the time to scale telehealth? Because it acts as a force multiplier. It allows our scarce specialists to reach patients hundreds of kilometers away. I'm sure you're aware that some countries don't have specialists. Maybe example is wrong, but if we don't have a dermatologist, they have to travel to the next country, the neighboring country that has one. It enables a remote diagnosis, consultations, and follow-up, dramatically lowering costs and insurmountable barrier of travel, that along with the risk what they have when they're traveling. Ultimately, it strengthens the entire primary care system and creates efficient life-saving referral chains. The current landscape is a story of both promise and fragmentation. Post-COVID, we saw accelerated adoption and pockets of incredible success. However, much of this is happening in silos. We have diverse, interoperable platforms and a lack of structure. While national digital strategies are emerging, the challenge is to move from isolated projects to an integrated continental system. You cannot virtualize care without physical foundation. Scaling requires 4 key pillars. First, the connectivity, specifically last mile broadband to reach the final clinic. Second, reliable power, which often means leveraging renewable solar solutions. Third, affordable devices, coupled with digital literacy so people can use them. And fourth, but not the least, robust but secure cloud hosting and data storage. Technology without supportive policy framework is like a car without roads. We need national health frameworks that provide standards and clarity. We need to solve the challenge of licensing healthcare workers across borders. Data privacy and cybersecurity are non-negotiable to build trust. We must create sustainable reinvestment models so doctors and clinics can be paid. All of this needs to be harmonized regionally through African Union and its regional economic communities. Within this framework, innovation can thrive. Our solutions must be mobile first and low bandwidth to be inclusive. We can harness AI for diagnostics and clinical decision support to augment our workforce. Point-of-care devices must integrate seamlessly with telehealth platforms, and critically, everything must be interoperable with electronic medical records to ensure one patient, one file across the continuum of care. So we did a SWOT analysis. I'm sure you know weaknesses we have spoken about at the cost of repeating myself: limited infrastructure and uneven connectivity in rural areas, fragmented implementation and lack of interoperability frameworks, and the threats are cybersecurity, privacy, data governance, vulnerabilities, economic constraints, and competing national health priorities. The strengths: strong policy momentum and post-COVID digital adoption, growing networks of innovators and health informatics associations. Opportunities: the regional collaboration through Pan-African Telehealth Network and Helena initiatives, expansion of digital financing and private sector partnerships. There are some success stories. In Rwanda, Rwanda shows us the power of policy-led integration with strong national strategy and PPPs. Kenya demonstrates hybrid model blending a mature tech ecosystem with national insurance reforms. Nigeria has a vibrant startup scene, is driving rapid private sector growth, and Tanzania is focusing on community-based grassroots expansion. Each offers a unique lesson in what works. We are a little bit behind, but definitely will catch up. Learning from these examples, we propose a holistic framework. This isn't a single solution, but a multi-pronged approach. It involves PPPs for large-scale projects, targeted public-private initiatives for research and development, and massive workforce training. We need sustainable financial models like cross-subsidization. A phased rollout ensures we learn and adapt, and all of this is underpinned by strong regional collaboration. Scaling, therefore, is a systems challenge. It is not just tech, infrastructure, policy, and innovation, and must align like gears in a machine. Our priorities are clear: commit to collaboration, invest in financing, and support local innovation. Our ultimate goal is simple yet ambitious: very clinic connected, every clinic cared for, and with one patient, one file across the continuum of care. This is the mission of the Pan-African Telehealth Network. It's an ambitious one, but it's achievable. How do we build this network? Through a phased integrated methodology. We start at the local layer, where we connect the patient to a nurse to a doctor to a specialist. We then build upwards, connecting clinics to district layers, then districts to regional referral hospitals. Finally, at the continental level, the Pan-African Telehealth Network proposes to connect everyone to a pool of remote specialists, breaking down the final geographic barrier. That's the basic framework we are talking about, connecting. So it's a busy slide, but I'm sure most of you would understand what I'm saying. A patient goes from the house to the clinic, and a nurse practitioner sees that more than 60% of the patients are managed by a nurse, but 20% of them are, when the patient walks in, the nurse says, no, it's not for me. I have to refer the patient to the next level. Where we can make a difference, the 20% of the patients where, with a little bit of help using technology, by getting advice in real time by a doctor or a specialist, I will be able to send the patient back home. So that's the basic framework, and this is how we would like to see happening. We want to have a community of telehealth, community of practice at a country level, and those networks will interact with other countries, and then have an international cloud server and a virtual call center. This slide is a testament to a growing coalition. We have active health informatics association. I've listed them out. There are 11 of them, and there are another 9 that are awaiting confirmation. And what we are trying to do now is, with the help of Village Reach, we are mapping maturity levels of telehealth policies across all member states, establishing telehealth community of practice at country level, and supporting interborder collaboration between countries. With Africa's CDC, we are busy trying to check the maturity levels of the member states. And with International Medical Exchange, there's going to be a conference sometime in March next year harnessing AI for health in Africa. So there's a lot of effort that's happening, but I will not pretend that this is easy. It is difficult but not impossible. And we cannot do this alone. This requires coalition of the willing. We need governments to pave the way for policy, telcos to provide the connectivity pipes, tech companies to build the tools, and NGOs to be our boots on the ground. It is like getting a band together. Everyone has a different instrument, but together we can create a symphony of change. I'd like to leave you with this slide. It doesn't matter how many resources you have. If you don't know how to use them, it will never be enough. I thank you for listening. In conclusion, thank you. In conclusion, our mission is clear. We are bridging Africa's distance to care. The journey is long, but the path is clear. I invite you all to join us in this critical endeavor. Thank you very much. Please join Sahia. As the President, I'm trying to get more members. Thank you very much for listening.